Are you thinking what I'm thinking? When is all this going to end? For months, countries around the world have been shut down. Empty streets have become the norm for 2020. But as nations begin to slowly reopen, will we manage to defeat the virus and go back to something like before?
It will go away, just stay calm.
This virus may never go away.
How long will this virus affect our day-to-day lives? Lockdowns may come and go, but will COVID-19 be an ever-present worry?
In my best case scenario, we have another 36 months ahead of us, and that's only if we come up with a really effective vaccine.
And what happens if a vaccine never comes along? In this video, we're going to find out how and when the COVID-19 pandemic might end, or whether it's here for longer than we might think. Now, a vaccine is the simplest way to end a pandemic. We know that dozens of groups around the world are rushing to find a vaccine, and usually that would take 12 to 18 months. But there's been talk of one coming even earlier than that.
It's possible we could vaccinate the population as soon as the end of September.
A vaccine would lead to the end of lockdowns and social distancing. The fear of the virus would disappear. The World Health Organization cited how the eradication of smallpox, which killed 300 million people in the 20th century alone, could be a benchmark for the battle against COVID-19.
Humanity's victory over smallpox is a reminder of what's possible when nations come together.
Of course, it did take centuries to eventually eradicate smallpox, and it was a very different disease. Its symptoms were obvious and apparent, so it was easy to quarantine and contact trace. COVID-19, on the other hand, can be spread by people who have the virus but show no symptoms.
All of these features make the virus, quite successful as a virus when it comes to human viruses. Many of us, the scientists and virologists, think that this virus will stay with us in our community.
As I speak, we don't know for sure whether any of the clinical trials will be successful, and if any are, it will take time to mass produce it and distribute it around the world. Yet another possibility is that we don't actually get a vaccine at all anytime soon.
I've worked in vaccines for 20 years. There are plenty of vaccines we'd like that we still don't have, or that work very poorly. I mean, flu vaccines. We say, we've got a vaccine for flu, maybe 50% effective. How long have we been making flu vaccines? We've been wanting a universal flu vaccine for a long time.
With COVID-19, there are already drugs that are being trialled to see whether they can help those who become hospitalised. However, these are the early stages, and finding the right antivirals can be just as difficult as finding a vaccine.
We have been successful, but not that majorly successful overall in finding drugs against viruses. Drugs, in terms of the development, the timings are much longer than vaccines.
That's why track, trace and isolate will likely be the mantra going forward for months and years. Countries will have to have a sustained and efficient system to ensure any cases or clusters are found and then contained.
I believe there will need to be some definitive medical intervention to switch this off as a massive global threat. But in the meantime, yes, the challenge is how to realistically and pragmatically help health systems and the society to adapt to the risks and impacts of this disease.
Now, it may be that this virus becomes endemic, something that has been mentioned by leading public health officials.
This virus may become just another endemic virus in our communities, and this virus may never go away.
But what does endemic mean? It's when there's a constant presence of a virus within a certain population or geographical area.
So, for example, you have yellow fever that's endemic in certain countries of the Americas and Africa. Whether this new coronavirus becomes established, it may well do so in some areas. There may be some places where they manage to stamp it out altogether, and then they only have to deal with imported cases.
Even if the virus does not become endemic, clusters could emerge, even during different seasons, and public health bodies will have to be prepared for that.
We need to be attentive and prepare for a potential second wave in winters, and how do we actually ensure that people are aware about that?
So as we wait for a possible vaccine, are we looking at the long-term process of herd immunity? That's where a high proportion of the population become immune to the virus by having been exposed to it. That's problematic. How long would that take, and how many lives would be lost?
So in this situation, we're looking at populations worldwide who've had huge outbreaks, and yet the proportion of the total population affected is still around less than 5 or 7% at the most. So that means that what we've experienced already, and only, quote, achieved 5% of infection in the population, we could do it 5 or 10 times over.
That's why without a vaccine or effective treatment, this could be a long, cautious process through this pandemic.
This, for countries, is a challenging balance of how do you keep the number of lives lost to COVID low, but you also keep an economy and functioning society, and don't destroy those in your pursuit of COVID containment.
If If it's tricky to answer when will this pandemic end, maybe we need to ask, how long will social distancing last? Take Australia. Look at these scenes. It's almost like normal. However, social distancing is still being enforced, and for the long term.
So the messaging to the community is that, the new normal is with us for a very long time. Just the physical distancing, the way we interact socially, hygiene measures, risk mitigation in the workplaces and public, working from home if you can. All of those things are basically down as this could continue for a very long time.
Australia's Deputy Medical Officer said, "We cannot afford to become complacent. The pandemic is not over." Certainly countries that had strong track, trace and isolate in place have gone back to normal quickly, but there are still clear warnings that people are living with the virus. In early May, South Korea's capital Seoul shut more than 2,100 nightclubs, bars and discos after a rise in coronavirus cases. The bans were in place until the city saw the infection rate lower once more.
There will be a constant collision between the idea that social distancing cannot go on forever and the idea that we cannot let our guard down, considering how contagious the virus is. We need to gradually open society while figuring out what methods of social distancing are effective and what methods we don't need to use anymore.
Is that what we have to prepare for in the short-term future as lockdowns ease? Targeted mini lockdowns as we track the virus?
I think this needs to be done on a local level. And so if there is a cluster of infections in a particular part of the country, it doesn't mean you need to lock down the entire country. What it needs to mean is you need a massive testing effort to try to test anyone who's connected with it, tracing of contacts of that, getting those people into isolation, and perhaps letting people in that area know this has happened. And so voluntarily, people start to, distance until it's brought under control.
All of this is a guide to what our lives may look like in the short term. More freedoms, but the spectre of the virus always there, the testing always required. If social distancing is going to last for most of this year, what about beyond that? Facebook said it expects about half of its employees to work remotely over the next 5 to 10 years. One study from Harvard said that intermittent social distancing may become the norm until at least 2022.
And now that a lot of businesses and workplaces have sort of seen what the balance looks like for people to work from home, those that can will probably open that up as an option and something that they will sort of be able to deploy more flexibly in the future when there are outbreaks like this.
We're already hearing that international flights are starting once more, with face masks being worn on airplanes and passengers' temperatures being taken at airports. Will that become the norm, not just this year, but well into the future?
Well, I think we're going to see lots of innovation, which we're already seeing in terms of air bridges between countries, which have similar levels of risk. So I think it's going to be a lot of arrangements done in small groups or in bilateral arrangements between two countries.
Much of this becomes about the pandemic's economic effects. If we ask, how long will the pandemic last? The economic impact of this could last for years and years.
So it is now very likely that the UK economy is facing a significant recession.
We may also see countries develop in different ways. Many world leaders have recently pledged to work together to combat the virus going forward. But what happens if, as the virus fades into everyday life, we lose sight of that cooperation? As some countries begin to ease out of lockdown and return to normality, will they really be worried if some other countries are still struggling?
It's so uncertain of how this is going to play out. But what we have seen happening is, in the case of Ebola, for instance, the minute it was declared over, funds were pulled out of West Africa, and suddenly people on the ground who were still in need of care and still in need, struggling with the disease, were left without resources.
So we are still in the middle of this global pandemic, yet many countries are moving to normality while others are mired in the crisis. As some nations see the pandemic end before others, will there still be international solidarity down the line? Now, I know what you might be thinking. I'm not sure I know when this pandemic is going to end, so I haven't done a good job answering the question. So here's my answer. We cannot say for certain whether we will have a vaccine by the end of 2020. In the meantime, we can see a path to a new normal, but it will be one with a system of track, trace and isolate to ensure that any outbreaks are contained. Basically, you may begin to live in a world without lockdown very soon, but it won't be a world without coronavirus.